You can control
Don't
that.
have sex.
Yeah.
Hey Didi family, welcome back to our IGTV, and finally we have Dr. Karen. I know I have been promising her appearance since October.
Yeah, as in, oh my god, I'm so
October.
happy. Yes,
Can you imagine?
It's been a long time.
It's been a long time,
but now we're here anyway.
Yes.
Yeah, and we're ready to answer all the questions
that you had.
Yes.
Yeah, about breast cancer and about
Cervical
cancer. Yeah. Let her introduce herself because Mimi nitakosa words introduce. So let her introduce herself, tell you a little bit about herself, where she works, and about her channel as well, because she really puts out amazing content on everything vagina.
Everything woman, everything reproductive health.
Yeah.
So my name is Dr. Karen Mithembwa. I am a registrar in obstetrics and gynecology. My main aim and my main passion is basically to talk to women about their reproductive health. I do this through my social media. I do it through YouTube as the Gynae Talks. I'm on Instagram as Kim Mithembwa, and on Facebook as Dr. K Official. So basically my work is to teach you how to keep yourself healthy, maintain your health, especially down there, the vagina, and get to learn more from you guys, because working with women is amazing.
You're always learning new things.
Yeah, you always learn new things. They'll even teach you, by the way.
Oh, really?
Yeah.
As a
some of
doctor.
these things will be like, yeah, okay. When did you start using that? Like people learn from YouTube, they learn from everywhere, but you have to also learn specific things from us, because we see every woman literally every day.
Alright. But then now that you just mentioned that whole thing about you learn like lots of content you can consume from the internet, but I think that's a bit unsafe if you don't because where's the filter? What do you think about that?
And like anyone can really pick up on a topic and give you the information from what they've checked on Google or through themselves, but they do not have the reasoning behind why some things are done, and they'll give you some information that's not necessarily the right thing. But maybe it could be working for them, but it might actually work the opposite for you. It would be better to get it from your health professional, and especially your personal doctor.
So not to mix and match.
Don't mix and match. Just basically talk to one, because they know your history,
How important is your relationship with your gyna? Like, should it be, what are the boundaries there? Should it be a guy, first of all?
You can choose.
Okay.
You can choose whatever you want, because they're male gynas, and you can't say that women now won't go to the male gynas, otherwise they'll be out of work. But there are people who prefer men, others prefer women, maybe because of their beliefs, their religion, and for specific reasons. Maybe the men are more gentle. I don't know. That's a belief. But we're not so bad.
I flashed back to when I was 14 and my first visit to the gyna, and it was a guy. And let me tell you guys, the trauma. That's why my gynecologist is a woman now.
Really?
Because it was my first time getting like a pap smear done. I didn't know what was going on, and you know that thing that they insert the speculum, and then it opens up.
Yes.
I almost kicked his head, because I was just thinking, what the hell is this thing? So we'll just jump right into it. I'll just ask you a couple of questions. We'll start with the cervical cancer thing, because that was the awareness month was in January.
Yes.
And at least there were a couple of questions that came up. And I guess we could just start from, I think everybody kind of knows the symptoms. And if you don't, maybe you can touch on a bit of the symptoms of cervical cancer. Like how fast, when does it manifest, and when do you notice it? Is it immediate? Like do you just look at it like, oops, cancer?
There's a problem.
What happens?
Okay. So cervical cancer is, I'll first describe it, because maybe not everybody knows what the cervix is and what cancer is. So the cervix is that area of the womb that opens up during labor to allow a baby to come out. It's like a kifuniko. We call it like a bottle top. You can imagine a bottle and then a bottle top. It opens and then allows the baby to come out.
I'm blushing.
So and every woman, most women have a cervix. Yes.
So that some women don't have a cervix?
The ones with abnormalities,
Okay.
there are
Alright.
people who have abnormalities with their reproductive system. So now when the cervix can get infected with HPV virus, which is usually a sexually transmitted infection.
And there was a bit of an issue with that because
Yes.
I think some people didn't understand that.
Yes.
What do you mean? Is it HIV or is it HPV?
HPV, they're totally different. It's called human papilloma virus. Yes. And it's the one that infects the cervix and makes the cervix change and get abnormal cells, and that's what we call the cervical cancer.
Right. Okay.
Yes. So and not every cervical cancer, by the way, is caused by HPV. Very few are caused by other reasons, but almost 98% will be HPV.
Okay.
Yes, and that is, you only get it after you've had your sexual intercourse. Yeah.
All right.
Yeah. So what happens?
So if you're a virgin, you're good.
I know you can't believe it's true, but I'm man enough to say to you, I'm a virgin.
Yeah, most likely.
Okay.
Most likely, because remember, there's the 1% of people who just tend to develop something out of it, or maybe it's another cancer that has gone down to up to the cervix. So what happens is that this HPV virus infects the cervix, and then it doesn't manifest as cancer immediately.
Okay.
It takes a couple of years before the cancer develops.
Okay.
And this is what we take advantage of now as doctors, to screen it early.
Okay.
Yes.
And there was a question on screening. So when you talk about screening and screening early, how many times should a woman go get checked? And screened for cervical cancer?
Ideally, as long as you're 21 years of age.
All right.
And above.
21?
Yes.
Wow.
21. From 21 years, if you're watching this, start your HPV. There's a HPV virus test, which is a DNA test.
All right.
And there's the pap smear, which is the most common test we do.
Okay.
Yes. So those two tests are very, very important. I would recommend that if you're already sexually active, just do pap smears. Whether you have HPV or not really doesn't give us, it's if you don't have it with the HPV DNA test, then that's good. We do the vaccines, which we'll discuss a bit later. But if you have it, then either way you'll still have to have a pap smear literally every 3 years, as long as you're above 21 years of age. If you're above 35 years of age, you can do it every 5 years.
Every 5 years.
Yes, because what happens is that it takes even up to 5 or 10 years before the cervical cancer develops.
Wow.
Yeah.
That's a long time.
Unless you have an immunity problem, like if you're HIV positive, then it means you can develop the cancer much faster than anybody else. So they have to have a yearly pap smear test done. It's very, very important.
Now, there are parents watching this, mummies, and this world has really changed. And people are now getting sexually active from it's sad, but 12, 13.
Yeah.
So what
probably
happens
even younger.
Even younger than that. So what happens? What would you advise that mommy who's watching this?
Yes. Now, unfortunately, most parents will not know that this is happening, but that's why we insist on talking to your young children from the time they're 8 years, especially the girls. Tell them about this. Talk to them about sex. Don't hide it from them. Don't be afraid, or if you're feeling uncomfortable, you should then get someone to talk to them about it. And then you just don't know whether your child is active or not.
Yes.
So it would be better that when they're 8 to 9 years, they should get that vaccine at that point. We just need to have this kind of a talk to literally everyone.
So we can't hide from the issue.
No, we can't.
And as a mom, I think you cannot afford to. And I think even compared to boys, just the way our reproductive system is set up, you're just prone to weird things. You can go to the bathroom and sit on the loof. It's public, things like that. So we're really prone to infections down there.
Exactly. And even the other thing is that we need to remember the boys as well. They're the carriers of HPV.
So can they be vaccinated?
Yes, they can. They can.
Important thing.
They can be vaccinated actually when they're also 8 years, 9 years. And why it's important is because being possible carriers, they will have a hard immunity. So if they are not getting it, then they will not give it to another person. So we'll tend to have lesser cervical cancer situations later on. But right now, as we speak, we have a generation of people, ideally all of us from a certain age, we've not had the vaccine when we were 8 years, 9 years. We just didn't.
I haven't been vaccinated.
Exactly. And now what is most important is doing the pap smear. which is the testing, because we are able to catch it even if it's in the first year or the second year. And the results you get with the pap smear, we keep on saying do a pap smear, do a pap smear. So what next after a pap smear? So it can come out normal, but for those ones who it will come out abnormal, there are things that we need to look at. It can come out abnormal, but does not mean it's cancer. It is just some changes that can happen because of multiple infections, chronic infection, the discharge syndromes that people keep on having, discharge. So now those changes can happen, but they can revert back to normal. So if you get an abnormality like a low grade squamous intraepithelial lesion, I know that's a long word. It's called LCIL.
You got me that.
In short, okay, fine. In short, it's LCIL. If you have an LCIL, it means you'll repeat your pap smear at 6 months, another one at 6 months. If that's a beauty with an LCIL. If the LCIL comes back positive again after 6 months, then we now consider to go and do another test to remove those cells that have changed. And you know what? When we remove those cells, we might have removed the possibility of those cells changing into cancer.
Oh wow!
Yeah, and that's why the pap smear is important. Yes, and there are people now. That's the first result you can get. The people who get something called HCIL. Now instead of low grade, it's now high grade. Yeah, but it's still not a cancer. Okay. But it is suggestive that it is converting slowly into one. Yeah. Wow. So what we do, we don't wait for 6 months. We go ahead and do the test that we would do in an LCIL when it repeats itself, and we remove those cells. And most of the time when we remove them, then you're most likely going to be okay.
All right.
Yeah. And then now there's those ones who get the cancer itself. Now if someone has the cancer, we have grades and levels of that cancer.
Okay.
Yeah.
Oh my gosh.
Yeah.
But is it treatable? Is it something at least you can hope to survive?
We can manage. Yeah, there are people who are survivors of cervical cancer. If we get it early, we're able to remove either the whole uterus, the whole cervix, if they don't want to intend to get pregnant.
Yes.
But if they do want to get pregnant, we can remove the part with the cancer. Hopefully it has not gone too further.
All right.
Yeah, and then they can get pregnant.
Yeah.
But unfortunately, if it is at a certain level, maybe stage 3 and 4, sometimes going back is difficult, but it's not impossible. Yeah, so we give radiotherapy, we give that is the kuchoma with x-rays, with those rays that burn them, and we are able to reduce the size and then remove the whole uterus at that point. Yeah, so yeah, there's a lot of treatment and a lot of changes and a lot of research that has been done on cervical cancer, but what I want to pass the message right now is let's not wait for it to get to that point. Yeah, because even the effects of the things we do, like the radiotherapy, you can get things like fistula. Now you get other complications. And that's what we get with some of the cervical cancer survivors. Those ones who are God just does things, and heals them. They tend to get that fistula, and then we have to fix the fistula later on. Yes.
Early detection saves lives.
Let me tell you.
You see that statement and you ignore.
Yeah. Just do it this year. Do it tomorrow. Even you and I, sometimes we are so busy. Like I should do it this year. You know. So you never know, as in,
and call out your friends and talk to your friends. I know that's the other thing, because if I keep mentioning it, because now I've become a person who now mentions boobs, because I'm obsessed now with them. So I'm always talking about, so when was the last time you did your self-check, with your bust and searching for like lumps and stuff like that, and everyone is just like, I forgot. And I'm like, no, you kind of have to do it. I'm also reminding myself just about that. And we'll get to another whole topic, part 2 of this video, that we talk about now breast cancer.
Yes.
So we talked about the HPV. So now we know, vaccinate both boys and girls. Just to recap. From 8 years, right?
Yes, from 8 years.
And you're
and it's free for the girls.
Oh, and it's free. So why haven't you done it if you have a baby girl?
If you have an 8-year-old baby, a girl, just get her vaccinated. It's free.
But for the boy, you'll pay.
Yeah, because they're not considered as the high risk. You're saving the girls, but consider the boys for their future wives,
for their future
partners.
Oh dear, I wish our parents knew some of these things, because it just came from a point of not understanding.
They didn't understand, and a lot of conspiracies. But
a lot of conspiracies about the HPV vaccine. Because that was my question. Is it safe?
It is safe. We've seen it, like we've had children having it and they're very fine, you know. Doctors' children are also having the same thing. I would do it for my children, you know. I'd rather that. So it's either you do the vaccine or just don't have sex, you know. But that's completely impossible, you know.
And it's harder to control.
Yeah, you can control
don't
that.
Have sex.
Yeah. Tell them that, they'll do the opposite.
Of that. Just wait people hit 12, 13 and they're like, you know what, mom? We get you.
Yeah,
I'm gonna do it.
Yes, and you can't say that you'll use barrier method. That's a condom to protect yourself from the HPV, because HPV is a skin-to-skin contact, just like the way you have herpes.
Okay, so which
condom will not protect you?
So you can get it from oral sex.
Yes.
Anal sex.
Yes.
Vaginal sex.
Yes.
Yeah, and even fingers, I guess, going there. So you can get it.
Yes.
You know, so it's just not.
It's not. So people need to know that. So we cannot say even if someone has HPV positive result, because I think one person asked me that question, whether they should be having sex now because they're afraid they're going to pass it to the next person. But everyone should know that most likely, if you already have HPV, the other person also probably has it. As in, it's just constantly.
So
you just do the pap smear. Just do the